Could you explain what is bypass surgery?
Blood supply to heart sometimes gets blocked because of the disease what we call coronary artery disease.
It is the highest risk.
Atherosclerosis. There will be plaques, that is thickening of the wall of the arteries on the surface of the heart or the inside heart.
Is there any difference between open heart surgery or bypass surgery?
When the narrowing is more than 70%, usually we advise
Before the blocking process starts,
this is sometimes very important. Many patients, they will tell that after taking food, I am getting pain. Sometimes it can cost the life of the patient.
blood checkup in every year or every 6 months.
Pressure normal or not, whether their sugars is under control or not, whether they have any brain tissue has a lot of cholesterol.
Warning signs of clogged arteries.
Through the bypass surgery, the most important is
Namaste, welcome you all to our new episode of Health Heroes of India. Today we are going to discuss a very important topic that's called bypass surgery. Bypass surgery is very common nowadays, and most of the people, those who are suffering with heart problems, they're going for bypass surgery. So in this topic of discussion, we will come to know about what is bypass surgery, what is the difference between bypass surgery and open heart surgery, and beaten heart surgery, and what are the symptoms, what is this treatment, what is the diagnosis. So many things as a whole we are going to discuss on this episode. So to know more about this episode, please see this video to the end, and then only you will come to know what is the bypass surgery and what are the heart related issues, why the bypass surgery is recommended. To know more about the bypass surgery, today we have invited our guest Dr. Padhy. Dr. Padhy is a cardiothoracic vascular surgeon, and he has more than 20 years experience in the field of cardiothoracic surgery. He is also a director of Medicover Hospital of cardiothoracic department, and though he has done so many of surgeries in his lifetime, so we'll know more about the cardiothoracic surgery in a detailed way, in the whole way. So let's welcome him to our episode and know more about what is bypass surgery. Welcome, sir. Welcome to our podcast, Health Heroes of India. Thank you for joining to our podcast.
Thank you, Vishwa. It's a nice program, and it's a good opportunity for me also to share my experience in cardiac surgery. And whatever questions you have, we are ready to solve those issues.
Yes.
Hope it will help the people.
Sir, nowadays people are facing a lot of problems on the heart issues, and for the heart issues, as you are a cardiac surgeon, so we'll discuss more about the heart issues. But as today topic is bypass surgery, sir, could you explain what is bypass surgery?
Yeah, it's a very good question. It is becoming almost a popular word, and the surgery is almost one of the most common surgery across the world. What exactly we do bypass means there will be some blocks in the coronary artery, the arteries which supplies blood to the heart. Heart supplies blood to all over the body, but unfortunately the blood supply to heart sometimes gets blocked because of the disease what we call coronary artery disease. And when we bypass those blocks with the help of surgery, we call it as coronary artery bypass surgery, but popularly people call it as bypass surgery. So what are the coronary artery diseases basically people face, the patient face? Yes, so there is a systemic disorder what we call atherosclerosis. There will be plaques, that is thickening of the wall of the arteries, resulting in narrowing of the arteries. Yes. It can occur in any artery, and it can occur to the carotid artery supplying to the brain. It can occur to the artery supplying to the legs, hands, and similarly various parts of the body it can occur. And so also it occurs the blood supply to the heart. Yes. The blood supply to the heart is done by coronary artery, and when it gets blocked because of this atherosclerotic plaques, we call it as coronary artery disease. If it is not significant, we just manage with medicine. When it is significant, particularly when the narrowing is more than 70%, usually we advise coronary artery bypass surgery or stenting as the case may be.
Sir, as a general people basically we know that bypass surgery, open heart surgery. Is there any difference between open heart surgery or bypass surgery, or both are same?
Yeah, if you look at the history of cardiac surgery when it started,
Mhm.
the cardiac surgery just started as a closed heart sort of surgery. That means there will be narrowing of the mitral valve, what we used to do their closed mitral valvotomy, or sometimes ligation of the patent ductal arteries. Some like that, some of the few cardiac surgery which has started in early 30s and 40s, 1930s and 40s. But the problem inside the heart we are not able to do. With the
Okay.
advent of heart lung machine, we
Okay.
could able to open the heart, stop the heart, correct the lesions. So at that point in 1953 onwards, when those type of surgery started, we coined it as open heart surgery.
Okay.
Now maximum heart surgeries we are doing on the surface of the heart or inside heart, with or without stopping the heart. So all these collectively we call it as open heart surgery. But bypass surgery or coronary artery bypass surgery is the surgery what we do on the coronary arteries which supply blood to the heart.
Okay.
And open heart includes all other surgeries of the heart also.
Okay, sir. Now we'll discuss about the symptoms and risk factor. So basically, when coronary artery blocks, before the blocking process starts, there may be some symptoms.
Yes.
Patient may acknowledge it or not, but symptoms are there. So, what are the symptoms and risk factor involved before the coronary artery fully blocked?
Yeah, it is a very important question. Everybody in the public should know what are the symptoms of the coronary artery block and when they have to report to the hospital and particularly to the Department of Cardiologist. The main, very important symptoms with which the coronary artery disease manifests is the pain in the chest, what we call in the medical language angina. So there will be,
Angina.
yes, there will be a retrosternal, that is the pain behind the chest bone. There will be there, and it will be little burning type, sometimes very cruciating type of pain, and that pain sometimes it will radiate to the upper part into the neck, jaw, head, and towards the side of the arms. So this type of pain, if it is there, then anybody getting such type of pain, they should report and get a thorough checkup by a cardiologist. We should not ignore this one. Second point is sometimes they will get breathlessness even at rest or with short walking or short climb in the stairs, and sometimes after taking a heavy meals, what we call as postprandial angina. This is sometimes very important. Many patients they will tell that after taking food, I am getting pain.
Yes.
And unfortunately, they confuse this with gastritis. They will take some gastric medicines and all. They forget the cardiac issue. That's how sometimes the disease becomes more severe. So, if this type of situation comes, then they should immediately consult to the doctor and do a thorough checkup. Sometimes it may not be because of cardiac, what we call the atypical chest pain, but still we advise they should come and get a thorough checkup, because if gastric pain, if it is ignored for some time, does not make a serious problem. But if cardiac pain, if ignored, sometimes it can cost the life of the patient.
Yes, yes. Yes, though it's a heart-related issues, patients should go and check thoroughly. And do you recommend in every year they should go for a regular checkup in every year or every 6 months?
Yeah, the standard guideline or what we make a protocol that anybody crosses the age of 40,
40.
they should have a routine checkups, not like hundreds of tests. People come with going various diagnostic places. At least they should check whether they have a blood pressure normal or not, whether their sugars is under control or not, whether they have any thyroid abnormality or not, and whether their lipid profile, whether that is within normal or not. These are the routine tests, they should get it. And if they are not symptomatic, if they don't have this type of symptoms like breathing difficulty or angina, they need not go for a intra-invasive checkups. But these are the checkups they should routinely have, and if possible, have a baseline ECG, which can be compared when if they develop any symptoms later. So once they do at 40 years, if there are some companies they do their staff for every yearly, but the public, if they are not symptomatic, it may not require every yearly,
Yes.
but once a while, maybe 2-3 years, or if they have some discomfort or anything,
Yes.
they should have a checkup.
So, do you recommend every yearly once or yearly twice?
No. If there is no abnormality, I think is a mass public, they can go for at least 2-3 years onwards.
Okay.
Every year also not required. But if they have any of these risk factors, whether blood pressure, high or
Start
diabetes,
breathing.
thyroid profile abnormality, lipid profile abnormality, any abnormal ECG, they should undergo at least every year to know that their heart is all right.
Okay. Sir, on the discussion only you told angina 2-3 times. So could you explain about angina and how a normal people will relate that one? Because basically, where the get pain starts and how that person will come to know that whether the pain is normal or it's angina pain. Please
Yes.
explain.
Actually, angina is a very typical pain, and we often say, and those people who have experienced angina, they can never miss it. And the whatever we develop various type of pain within the body, but the angina or the cardiac pain is such a pain that once somebody feels, he will know that it is something different.
Okay.
So very important is it will be in the retrosternal area, and slowly it will be like excruciating pain, or it will be like very deep seated pain, which is slowly coming up, going towards jaw and radiating to the both the arms. If that type of pain coming, and besides pain, we should know what is the instigating factor.
Yes.
That same pain, suppose somebody is getting every day after walking for some time, or every day after taking food, then definitely it is cardiac pain. But sometimes, occasionally, somebody gets a pain and that stops. After 1 month, again gets, it may not be a cardiac pain. It is some other atypical pain. And most of the pains, what we confuse with the cardiac pain is the gastric pain. Sometimes people have gastritis, reflux esophagitis, because there also will get retrosternal pain. So that may be confused. Or sometimes some atypical pains we get, because pain can occur in any organ. It
Yes.
can be in the muscle, in the bone, or anywhere. So those things also get confused with the anginal pain. Besides this, there are some other pains which are also very excruciating, a very heavy pain. Those are sometimes when there is a aortic dissection or aortic rupture sometimes, or sometimes there can be a pain because of heart related, like pericarditis. All those pains also can mimic like arterial pain, anginal pain. Sometimes esophageal perforation or esophageal rupture which occurs, that also can give rise to very severe pain. Or sometimes tension pneumothorax, patients develop air inside the lungs cavity.
Okay.
That also can give very severe type of pain. So whenever anybody gets a severe type of chest pain, they should consult a doctor. It may be negative, that may be a typical pain, it may be nothing, but we should not ignore.
Sir, if the patient comes to you with pain, some kind of pain, who is the highest risk? What kind of patient? Those are suffering with highest risk, and you detect them at the higher side. They should go for the higher surgery, bypass surgery.
Yeah, usually patients when they come to OPD, usually they get evaluated by the cardiologist, and we see how the patient is symptomatic and what are the other risk factors patient is having. If the patient is having any of the routine risk factors like blood pressure, diabetes, thyroid issues, high lipid profile, then they are at the risk of, and they should get a complete checkup. Besides this, there are other issues what makes compelling to check, one is if they are very obese people, then also chance of possibility of having a cardiac problem is there. And genetically and familial history. Suppose somebody's parents died because of sudden heart attack, or in their family some other person also died, they also developing a chance of getting a heart attack is high. One is because of genetic contribution. Second thing, when we live within a family, our lifestyle, our
Yes.
food, our stress, strain, our attitude, behavior, everything more or less same. So those things must be may be contributing to these people, particularly when any parents had a sudden death or something cardiac. We should have a checkup, because possibility of having a heart attack or cardiac disease is very high in those people.
Sir, I have a question, sir, regarding what is the cholesterol? Basically, doctor says cholesterol is high. So, could you define it so that people will
Yeah,
understand?
cholesterol, these are the actually what we measure is the lipoproteins and the proteins which carry the cholesterol.
Okay.
Cholesterol, what we popularly think or tell, it is a very bad. Actually, it is not bad. If you look at cholesterol, is very necessary for the body.
Okay.
If there is no cholesterol in the body,
Mm.
or all cells will get damaged, because
Okay.
the cell wall is formed with the help of lipids, cholesterols.
Cholesterol.
In the brain, brain tissue has a lot of cholesterols. Our heart requires fatty acids as an energy source. So cholesterol is absolutely required for the body. But what happens when there is excessive cholesterol, or there is a metabolic defect in the synthesis of the cholesterol and excretion of the cholesterol? They get deposited in the arteries, various arteries, particularly coronary artery, what we are discussing.
Mm.
So to prevent that, we should have a cholesterol level of within normal limits, and we should not allow our vascular system to be inflamed at any point of time, because if the vascular tissues are inflamed, then they become the needles for the deposition of the cholesterol, which makes the problem. And to become inflamed, there are a lot of factors what the risk factors contributes.
Mm-hmm.
Same risk factors,
Yes.
diabetes, hypertension, and our lifestyle of sedentary habits, various junk foods what we eat. All these makes the vascular system bad, unhealthy, and on other unhealthy system, this cholesterol gets deposited.
Okay.
That's why we sometimes see with normal cholesterol also patients develop coronary artery disease.
Mm-hmm.
That is where all these risk factors plays a role.
Okay.
And very important risk factor is diabetes. That's why we say if somebody is developed diabetes, it is a overt diabetes, diagnosed is on drugs or insulin. That means already he is at the foundation of the development of the coronary artery disease. It is almost equivalent of developing a coronary artery disease. Whether it is significant or not, we have to investigate and see. But he is already entered into the phase of coronary artery disease. That is
Okay.
so important.
Okay. Sir, are there any early warning signs of clogged arteries? People sometimes ignore that one. Anything is there?
Yes, that's a very good question. That's why many people they think that I am absolutely all right. Why I developed block?
Yes.
I don't have diabetes, hypertension. Why it happened? Like
Yes.
that question sometimes people ask. So definitely there are so many other risk factors people there who will be evaluating with advance of medical science. But what is more important and what is more serious in the cardiac issue is, so when some people develop sudden cardiac death, you might be seeing and
Yes.
we are getting the news, somebody early morning he's collapsed, or some film stars
In
and
the gym
somebody in the
also.
gym, people
Yes.
get suddenly. So why it happens when somebody is going gym or running, they are fit what we feel, but they don't undergo checkup. That's why above 40 years somebody is going gym, they should have a complete cardiac checkup before going for gym. And just going for gym and going for a walk does not preclude us for not getting cardiac problem.
Problems.
So it is very important, because what is happening in the coronary artery we are not knowing.
Mm-hmm.
And
Yes.
I have seen people, they are playing tennis, suddenly collapsed, and they are coming to the hospital. They will be asking you 20 years we are playing, why today developed? That means the coronary artery getting narrowed from that time, maybe 5 years, 10 years.
By
And
blocking
when
the
it becomes very significant, the blood flow is not there. And when they get exertion, then the blood requirement of the heart is more. And that is the time when the narrowed artery, when blood does not go, that is the time they develop the symptoms and get a heart attack. And the other point is sometimes, as I was telling, the inflammation in the coronary artery where these lipids deposit, that makes a plaque. And these plaques are of two types. One is a stable plaque, another what we call is an unstable plaque. When the stable plaque, even if the narrowing goes to 80%, 90%, they may not be developing symptoms because it occurs over a period of time.
Okay.
So that particular area gets blood supply from other places by getting collaterals.
Yes.
But when there is unstable plaque and when it ruptures, their platelets, WBCs, RBCs, what are in the blood, they clog that artery. So when they clog that artery, there will be complete block and it occurs suddenly. That's why they get the sudden myocardial infarction or heart attack, what we call. And if it is a very severe degree, patient sometimes collapse. They don't give time us to treat.
Means what you are telling, plaques depositing are going on,
Yes.
but there is no symptoms. But suddenly, when the people or the person doing more exercises, and that time only it occurs that heart does not get proper bloods.
Yes, requirement is not the
Not-
supply. The supply is less than the demand. There will be a mismatch between supply and demand.
Yes.
When we exercise,
Yes.
the demand is more. When there is narrowing, it cannot supply. That is how the supply demand mismatch comes. That's why people, when we are walking, exercising, or even after heavy food, we get the angina. If it is very severe degree, and there is a very unstable plaque, when it ruptures, sometimes they get a heart attack.
I think it's a nice discussion till now. We have come across so many things, symptoms, risk factors. Sir, when the person comes to you and you feel you come to know that he is suffering with angina and there are some coronary artery problems is there. So, what are the diagnoses you go through? You do.
Yeah, when they come, we first do a ECG, then scanning of the heart, echocardiography. Then if a patient is symptomatic or is not able to tell, maybe we have to do a treadmill test where we make the patient to exercise with proper ECG monitoring. So there are some findings on which we can think of when they may be having a coronary artery disease or not.
Okay.
Another thing what we routinely now do is a calcium scoring. That means when there is a block, usually there will be calcium deposits.
Okay.
So we do a plain CT scan where we will know the calcium deposits. If there is a calcium deposits of say more than 400 in a particular person, then definitely they will have some coronary artery disease.
Okay.
Ideally, it should be 0 or less than 100. If it is more, then definitely they will have a coronary disease. But to have a full surety, the gold standard investigation is coronary artery angiogram, or we can do a CT coronary angiogram, so that we can know exact of block, how many block, percentage of block. Then we can plan whether they have to go for surgery or stenting or medical management.
Okay. So, sir, the coronary blocks basically due to deposit of fat or cholesterol on the surface of the coronary artery, this form. Could you tell me that blocks, how it forms, why it deposited on the heart, coronary artery?
Yeah, actually it deposits anywhere in the vascular system, as I told.
Okay.
And coronary arteries, because of it's a small vessel and it is continuously, heart is continuously beating, other organs have some rest. Suppose there is say blood supply to the legs. When we are not working or when we are sleeping, it is that much demand is not there for blood.
Okay.
But heart is beating from the birth till death. So there is a continuous blood supply will be there. So a lot of this cholesterol, whatever the circulation, they will be going to the coronary arteries. So if there is a inflammatory state in the vascular system because of various stress and strain or metabolic disorder, that vascular bed has become unhealthy, and on that unhealthy vascular bed, these cholesterols gets deposited.
Okay.
So that's why sometimes a small group of people, if they have a good vascular system, the coronary bed is healthy because of their healthy lifestyle, no stress and strain, they don't have diabetes or thyroid disease, blood pressure is normal, they live a very good life, what we call in spiritually very sattvic life, very content, then their vascular system is very healthy. So even if they have some cholesterol, that does not get deposited
Okay.
on there. So they will have a very good vascular system.
Sir, bypass surgery is the option. Are there any non-surgical treatment to replace the bypass surgery?
Yes, actually, a fragment of the patients only go for bypass surgery in coronary artery disease. If you see the total spectrum of coronary disease, maximum people will be managed with medicine. And we think of any intervention when there is a disease, the stenosis is more than 70%. If there is a less stenosis, usually we don't advise anything. We advise medicines and to have a lifestyle changes. And if there is a small block, one block or two blocks, discrete blocks, sometimes our cardiologist friends, they do stenting of those blocks.
Okay.
Stenting means where there is a lesion, we put a stent so that the blood flow will become normal. A 70% suppose block is there, we put a stent so that block is relieved. That is known as stenting.
Explain some stunting, because right now nowadays people are using stunting, but explain it. What is stunting and how it
Yes,
helps?
it is a non-surgical procedure,
Okay.
and it has also evolved for last 40-50 years. So initially bypass surgery has started for these blocks, but instead of surgery, how we can do that? So this stents has come up. So where there is a block, we put the stent there so that the block will be relieved. That is done by our cardiology friends.
Okay.
But the issues with block with stent is we are putting the stent in a unhealthy area,
Okay.
and that is a foreign body which stays in the coronary artery.
Okay.
So there are chances of getting thrombosed in that stent because it is a foreign body there, and it is in an unhealthy area.
Okay.
Because where there is stenosis, usually that part is unhealthy. As I told,
Yes.
it is an unhealthy bed, and on that this is deposited in an unhealthy area, a foreign body. So the chances of getting blocked or getting re-stenosed, say after 6 months, 1 year, chances are there. But if properly selected in properly cases, even stent also can work longer period of time. So that critical decision has to be taken by cardiologist, and that segment of patients, if properly chosen, stent is also a good option in coronary artery disease. But if there is multiple blocks, very bad coronary arteries, and if there is a critical block in the important coronary artery, what we call left main coronary artery, those cases always bypass surgery, coronary artery bypass surgery stand good, and it has been proven by multicentric registers, by various trials, syntax trial and many other trials, which has proved that in those multiple blocks, coronary artery bypass surgery is a good option. But there is still very important role of the medical management and stenting. So these three options has to be chosen very judiciously by the doctor with consultation with the patient, because patient's choice also is very important.
Yes.
Sometimes some patient will tell, I don't want surgery, but he is suffering. So in that case, maybe judiciously we have to think of stenting, or sometimes if it can be managed with medically, we have to see and manage medically.
Okay. First of all, you have to educate the patient regarding
Yes.
the things. Then only we can plan as per the issues. Sir, how does bypass surgery improves the quality of the heart functions, and how after bypass surgery what happens?
Yeah, when we do the bypass surgery, The most important is if the patient come with angina or dyspnea, pain, breathing difficulty, that gets immediate relieved. That is a very important point, and particularly those patients come with continuous pain, they will feel the next day of surgery itself they are not getting that pain. So the heart pain is such a typical pain. Only who has experienced it only they will be knowing. It is like labor pain. When a childbirth time, the ladies get labor pain. Whoever got, they only know how cruciating, how the pain severity is there. Similarly, heart pain also something like it is not like that very excruciating pain, but it is a very typical pain which a patient sometimes got, he will never forget. So immediately they will get relief out of that pain. That is a very important point. And the second thing is because of this heart disease, and when they get it, they limit themselves to go to the work. So that once they get relieved, they within 15 days, 20 days, they start going to the work. So quality of the work will improve, quality of their life will improve. When they were restricting themselves, they can go to the work, whatever their hobby or whatever they want to go somewhere, all those things will be improved. So the most important part, benefit of the coronary artery bypass surgery is to increase make benefit of their quality of life. Then coming to the survival benefit, it depends how critical the disease was there. Suppose the disease was very critical, definitely the longevity also improves. We have seen patients even 30 years, 40 years back undergone bypass surgery, they are living normally. So that is a major benefit they get. But it may not happen with every patient, because some of the times we get patients after heart attack when their heart has become weak. So in those cases, the survival benefit may not be that high. Normally, our heart ejection fraction, what we call it, will be around 60%. But unfortunately, some people develop heart attack, their heart function has come down to 30-35%. So there, the longevity part will be an issue, but their quality of life definitely will improve after coronary artery bypass surgery.
Sir, right now, what kind of surgery you are doing, like bypass surgery or any kind of open heart surgery? The advancement, technical advancement is there. And what are the advanced technology you are using, and what are the bypass?
Yeah, the medical science is advancing in a very rapid way, like any other science, as we know, and many different technologies, techniques are coming. So overall, cardiac surgery is also pacing in that way. If we limit ourselves to the coronary artery bypass surgery, initially we used to do by arresting the heart, stopping the heartbeat, and we support the heart and lung with the heart-lung machine, and we are doing the bypass surgery. Then from late 90s and 2000, the technique of beating heart surgery has started. And we are doing on beating heart this bypass surgery, what we call beating heart coronary artery bypass surgery. And I can tell proudly, we the Indians are in one of the topmost rank for doing the beating heart cardiac surgery. If you look at the whole statistics, in my personal statistics, I am doing almost 97 to 98% of the patients on beating heart. And overall, Indian statistics stays somewhere around 60 to 70%. But if you look at the West, America, Europe, even Australia, there the percentage of beating heart is very less. It comes to less than 20%. That is a major area where the Indian surgeons, we have grown to the Western population because of our high volume of patients and our dexterity in our skill setup, and of course our hard working and all those things that makes a difference. Coming to the other advancements, what we have is the minimal invasive cardiac surgery, where we do a small hole instead of full cutting. We can do the bypass surgery, but the issue is when it comes to the bypass surgery, coronary artery bypass surgery, the risk benefit we have to see. Sometimes if there is a critical block, if patient is very symptomatic, we should not risk the life of the patient. So judiciously we have to select which of the patients can undergo minimal invasive cardiac surgery. And the third advancement which is coming up is the robotic cardiac surgery. And of course, there we are little lagging behind in comparison to West, because we don't have that sufficiently robo and of course the training and all. But I am sure if our future generation will come up with a good advancement in the robotic surgery. Maybe our generation may be struggling to get into that, but I am so sure the future generation will come with a good advancement in the robotic surgery, and with the initiation of the artificial intelligence, machine learning, more and more advancement will come into this field shortly.
It's a proud moment for all Indian that our Indian cardiac surgeons achieved 90% like beating heart surgery.
Yes.
Sir, what is the beating heart surgery? Please explain.
Yeah, beating heart surgery means we don't stop the heart. When you open the chest, as usual, the heart will be beating. When
Okay.
it is beating itself, we stabilize a particular area where we will be putting the bypass graft,
Okay.
and we do the procedure, and heart will be beating. So it is a little bit sometimes stressful. Sometimes our cardiac anesthetists, they have a major role to stabilize the blood pressure of the patients and all, by giving various drugs or manipulation of the positions and all. So, but it is a very challenging situation. But the advantage is we don't stop the heart. So same heart will be beating. It is something like when car is running and you try to do something like that. So sometimes it is stressful, but it is happening and it is possible, and we are doing it. But sometimes if the patient does not tolerate, or there is some rhythm changes, or patient develops some blood pressure low and all, then immediately we have to go. We have to give support of the heart-lung bypass,
Okay.
what we call cardiopulmonary bypass,
Okay.
and with that we do the bypass surgery. Even there also we don't stop the heart. Heart will be beating, and we will be with cardiopulmonary bypass support. We will be operating.